Hi, my name is M. Adam. I am a student at the University of Minnesota College of Veterinary Medicine, and when starting this research, we were looking at cardiac arrhythmias, which are an important cause of sudden death in the horse. Overall, we started looking at atrial fibrillation, which is the most common and best characterized cardiac arrhythmia that is known to be pathologic. Unfortunately, identifying horses at risk for AFib before they develop AFib is currently not feasible due to the absence of underlying structural cardiac abnormalities in most affected horses. But given the similarities between these forms of arrhythmias in humans and horses, it is likely that the alleles are an important cause of arrhythmias and sudden death in horses, which led to our project of identification and validation of alleles for cardiac arrhythmias and atrial fibrillation. Using whole genome sequences of 6 standardbred racehorses with AFib, we identified 4,066 putative arrhythmia-causing alleles in 309 genes known to cause cardiac disease in humans. The aim of the study was to obtain evidence to support the pathogenicity of the identified alleles using computational tools. Our methods for this research involve starting with WGS of 6 standardbred racehorses with AFib, and then variants were selected in cardiac disease-causing genes using ClinVar, and then after this we identified our rare variants and common variants. Common variants were present at a higher than expected frequency in the general population based on a reported prevalence of atrial fibrillation in healthy standardbreds, and then typically disease-causing alleles are rare in the general population, and therefore rare variants were obtained based on the prevalence in the general population of less than or equal to 5%. After identifying these rare and common variants, we used NCBI BLAST and IGV to determine and exclude false positives, and then used a various amount of programs such as Conserv, Provian, SNPs and Go, SIFT, and BEST to determine the pathogenicity. Overall, we had a total common variance of 572 and total rare variants of 512. As for results for our rare alleles, we had 512 alleles that were likely to have an effect on the phenotype, about 78 alleles, which was about 15%, that were determined to be false positives due to poor reference genome annotation or genotyping errors, and in total we had about 116 alleles, about 23%, in 99 candidate genes that had sufficient evidence to be considered putative arrhythmia-causing alleles. For our common alleles, we had 572 alleles that were considered common, greater than 18%, in the general population and likely to have an effect on phenotype. Only 8 alleles, about 1.4%, were determined to be false positives due to a poor reference genome annotation or genotyping errors, and in total, only 59 alleles, about 10%, in 41 candidate genes had sufficient evidence to be considered pathogenic despite their high frequency in the general population. For the future, these 116 rare and 59 common alleles that were determined to be true positives will be genotyped in 1,200 standardbred and thoroughbred racehorses to test for associations between the mutations and the presence of cardiac arrhythmias and/or sudden death. The overall goal is to identify mutations that show a horse is at risk for sudden death so they can be monitored more regularly and eventually help to prevent sudden death in racehorses. I would like to thank the following for providing funding for this research: Morris Animal Foundation, University of Minnesota College of Veterinary Medicine Summer Scholars Program, the USDA, and the American Quarter Horse Association. Thank you.